struggle, to say the least. But they also tell me that these last 2 years, can you believe we're saying that, have made them well practiced. This is not our first and likely not our last surge of COVID-19. And to say frontline workers are feeling it would likely be an understatement.
Yeah, nurses are certainly overworked, exhausted, undervalued. We've been through 5 surges to this point. This will be the 6th.
As Omicron pushes case numbers across the state to record heights, hospitals are preparing, and so are nurses.
COVID-19 itself is a danger that multiplies.
Kevin Mealy with the Oregon Nurses Association says staffing should be one of the biggest concerns.
Nurses have actually contracted COVID-19 at a much higher rate than the general public throughout the pandemic.
We are seeing a lot of people getting infected in general.
Dr. Carl Erickson is the medical capacity officer with Dornbecker Children's Hospital. He confirms it is a major concern, one they are preparing for.
In terms of staff, they're probably the single most limiting resource for a lot of the care that we provide.
That means sometimes they have to get creative.
So what we're doing to prepare is that we are trying to utilize our staff in the most thoughtful way. Right now is a pretty tough time for a lot of healthcare organizations because our staff is pretty limited due to primarily people who are infected or are having to quarantine as a result of having been exposed to someone who's infected or having to be out for some other reason related to the pandemic.
So it's obviously a tough situation, and that reality is true for all hospitals. And all major hospitals in our area tell me that, of course, they are committed to getting the best care to their patients and will find a way to work through these struggles. They also tell me that they are well equipped and practiced at this. As I mentioned, can't believe it, but it's been 2 years.
He says as cases spiked in the last few weeks, demand for rapid tests went up. And now, as those become harder to find, PCR tests are in short supply as well. I look to see the effect this is having on clinics, as well as advice that experts have for those worried about exposure.
Zoom Care is one of the places people can find a PCR test. First, you talk to a provider virtually. Then, they set you up with a testing appointment. The interim chief medical officer says by midday, day of appointments are usually gone. But Mark Zeitzer tells us not everyone needs an appointment.
So the one that you can buy at the pharmacy down the streets is pretty good, and they've gotten better over time. If you turn positive on one of those tests, especially if you are symptomatic, you've got COVID. We're done.
Both Zoom Care and county health officials say right now, staffing is the biggest hurdle to increasing testing locations.
It's very challenging because we're having the same issues that everybody else is, in that some of our workers have gotten sick from being out in the community. And so they can't be at work, which ends up reducing our capacity.
The Oregon Health Authority says across the state, there are enough PCR tests to meet the need, just not enough healthcare workers to administer them.
In addition to sending out self-testing kits, OHA says it's adding testing sites statewide. The health authority currently runs 21 locations and now is looking to expand that.
Well, Deb, as you just heard, parents are split. Some are pushing for kids to go back to remote learning, while others say they should be staying on campus and doing distance learning will only do more harm. State officials warned us last week, more and more schools will be moving remote.
I'm increasingly worried about what I'm seeing coming out of the schools.
To the dismay of some parents, it's exactly what's happening. On social media, we saw the schism. We asked people to share concerns about distance learning. One user saying mental health, another commenting still paying therapy for the last time. Kids need social interaction. Others writing they have no concerns and whatever is safest should be done.
My kid is afraid to eat lunch at school.
Marnie Glickman has a 15-year-old at Grant High School who's fully vaccinated and boosted.
I think we should be online until this spike, shows some sign of changing.
PPS has already moved 4 schools to distance learning. Grant, not yet one of them.
A 10th grader, 12th grader, and 7th grader.
Eric Happel's kids are also still on campus, but he wants to keep it that way. He says distance learning,
it's pretty much useless from an education standpoint.
Eric says mental health needs to be considered when taking kids out of the classroom. The former U.S. Surgeon General, Dr. Jerome Adams, agrees, saying getting kids in school should be priority number 1.
It is critical that we recognize the harm that has been done to our children due to mental health issues, due to educational issues.
According to the PPS dashboard, there are about 1,500 students and staff in isolation or quarantine because of COVID. But the district says none of those cases are due to exposure on site. Amarni says with this current surge, it's time to make tough decisions.
I think the school boards need to be brave enough to require the COVID-19 vaccine. My teen is required to have more than 10 vaccines to go to school, but not the COVID vaccine.
Now, the PPS board was supposed to vote on a student vaccine mandate this fall, but they tabled that discussion and they have yet to vote on it.
Well, Catherine, the owner here tells me they already canceled 90% of shows for January, and they expect that trend to go into February as well. Venue owners tell me even if a show does go on, they're lucky just to break even. And now they're hopeful for normalcy to return by the spring.
At Revolution Hall, the owners have added tools to improve public safety. They check for vaccine cards or negative tests and provide testing on site as well. But Jim Brunberg tells us this has not been enough to prevent cancellations.
Most artists have canceled their events. At Revolution Hall, we had every concert except for 2 cancel for the month of January, and a lot of February is canceling. So where we feel we can put on events safely, the confidence is just not there.
That's happening at the coast as well. The Liberty Theater made the decision to close for the month of January after 15 cancellations.
But overwhelmingly, it feels like our patrons don't feel comfortable to come out. Our performers maybe don't feel comfortable. But it's challenging because no matter what decision you make, you're going to anger somebody.
Jennifer Crockett says the theater already faced challenges going into the season. Tours were limited and someone around Oregon because of restrictions. Now, venues are trying to adapt.
We're sort of making event decisions on a rolling basis every 2 weeks. We look at the numbers in our county and look at the ticket sales. We've been surveying our patrons and surveying a lot of the businesses around us. So we are trying not to make decisions in a vacuum.
Brunberg tells us they're still seeing hurdles even when performers are ready to go.
And the ones that don't cancel, the attendance is down to about 65% of what it would be. A lot of people are buying tickets and then just not showing up because they make a last minute decision because they see the news or just have a gut feeling that they don't want to go out.
Both venues tell me this is also creating headaches around planning for the rest of the year. We'll show you how event spaces are working to survive during the 3rd year of the pandemic, coming up tonight at 6.